Microdosing TRT. What's it all about? Well, the principle behind it is achieving stable levels with the minimum effective dose and frequency of injections. Now, traditionally, testosterone replacement therapy hasn't been prescribed very well because unfortunately the manufacturing guidelines are pretty horrendous. Now, I did write a blog, Gold Standard TRT, which went into the details of the pharmacokinetics and how the absurdity of the manufacturing guidelines were not backed up with science when you want to try and establish stability. So I won't go over that again. However, the principle is sensible. You know that when we measure trough levels, it is the base level. So you have a peak and a trough when you have the metabolism of a drug, and some people feel it's okay to have a big peak as long as your trough level is okay. Now that's absurd. Now we want to achieve stability, so we want to achieve as close to, damn it, stable levels throughout the week, the month, the year, however long you want to say. So we're aiming not to have fluctuations. Now, it's obviously impossible to not have slight fluctuations. You're obviously injecting a dose of a drug, so it has to be metabolized. So there will be a peak and there will be a slight trough. Now, the dose and the injection frequency that your doctor should be prescribing you should take into consideration a number of factors. Now, obvious ones include SHBG. So if your SHBG is high, you don't have to have such frequent injections. If your SHBG is low, you do, because essentially you metabolize the testosterone quickly. Obesity, alcohol, loads of things that affect aromatization. You need to take this into consideration when designing a protocol. Now, what does microdosing mean then? Does it mean you have to inject every day? Does it mean every other day? No, it just means that you have to appreciate that the pharmacokinetics of a drug are only part of the picture. So the individual parameters, your physiology will dictate what sort of dose and injection frequency you should be on. Now, we're pretty good at designing a protocol. However, we're not perfect. There are issues such as genetic factors that can cause overexpression of the testosterone enanthate. There are things that we can't really predict for as much as we'd like to, because everybody's different. You can take somebody of exactly the same size, same age, and their protocol will be different. What's interesting recently is we are finding that the HCG component of your TRT is incredibly important. Now, I used to think of it, I always thought it was integral, but I didn't really appreciate how integral it was. So the Americans, their starting dose is 100 milligrams of testosterone, and when they do surveys, they don't even consider doses less than 100. Most of my guys are on less than 100 milligrams of testosterone. I've got guys down at 40 milligrams a week of testosterone, obviously in divided doses, but 40 milligrams, and their corresponding HCG dose is 100 IU of HCG daily, so 700 IU a week. Some are on higher doses, especially those ones who are wanting to retain fertility, because you can retain fertility on 100 units a day. but I did recently up a guy's HCG because he wanted his best chances of conceiving, and I'm pleased to announce that he reported back the other day that his missus is now pregnant. So we've lowered his dose down again because he was having a few issues with the slightly higher dose, but it was job done. So I'm actually absolutely thrilled for him. So microdosing, it's about using the most effective dose to achieve the desired outcome. And the desired outcome is to establish stable physiological levels of all of your male androgens, your free testosterone, your estradiol, and your DHT. Because we know that obviously doses higher than you actually need will cause side effects. And one of the obvious aims of a decent TRT protocol is to not cause side effects. If you are causing side effects, then you are potentially causing harm. So you want to not subscribe to the more is better brigade. You want to understand that your physiology, your genetics are particular to you, and your dose and frequency of injections should be titrated according to your individual needs. There is no one-size-fits-all protocol, and I think the other thing to be aware of is the fact that your physiology changes. One of the guys on the group recently posted that his estrogen has significantly dropped from losing 5-6 kilos. Now that's brilliant news. So why is that? Well, because increased adiposity, so increased body mass from fat, increases expression of the aromatase enzyme. So your physiology does change. So you do have to appreciate that when you are optimized, it doesn't necessarily mean that that is going to be your dose for the rest of your life. We've got a number of guys who we started on every other day injections because of their low SHBGs, and their SHBGs have risen. You know, SHBG tends to find a natural level. SHBG tries to help you. So, you know, I'm quite averse to this kind of idea that we need to try and reduce our SHBG to free up some free testosterone. Your SHBG finds a natural level. So what do you need to do? You need to try and optimize your male androgen levels, which will then allow your SHBG to find its natural place. So TRT is quite complicated. As I've said before this on numerous videos, you know, it seems very simple from the premise that you replace the testosterone with testosterone, you replace the LH with HCG. But it's always a work in progress. Much like life, it's a work in progress. You know, you can't ever rest on your laurels. You have to continue to do what you need to do. And from a health perspective, you know, that is constantly look at your lifestyle, constantly look at your nutrition, constantly look at your physical activity, optimize your hormonal health, and then look to modern medicine to help facilitate that as an adjuvant. So, microdosing testosterone. What's it all about? It's about doing things correctly. Alright, ta-da guys. Listen, I do really hope you appreciate the high production value of these videos. I'm currently sat in my Land Rover in a retail car park, talking to a phone. I'm just waiting to flash my lights twice. You know what I mean? I'm joking. All right, have a good day, guys. Ta-da.